I just wanted to come back to the training, and I just wanted to make a comment more than anything. I'm just wondering if we're missing a trick, because we're talking about nurse practitioners now as a profession, whether the training, and I'm not knocking the training because there has been nothing before for practice pharmacists, but should these education programs be an advanced practice and training program, an MSc, that basically qualifies them as a nurse practitioner?
Okay, right.
And I have some experience on this because
right.
I've gone through the program.
Okay. First thing, I don't think the profession has decided if that's the right route for individual pharmacists, and I don't understand why pharmacists would need to be trained that way to become an advanced practitioner myself personally. So I don't think that's the right route, because actually it's a very different foundation of training and undergraduate training between a nurse and a pharmacist. So I personally don't believe that. Secondly, yes, it would be ideal to fit to an MSc, and yes, the president of University of Manchester would love that. The other universities across the UK would not like that, so there would need to be a proper commissioning arrangement and procurement arrangement. So that's not feasible at this stage, just from the pace. That might happen in the future when we get to 2,500, let's say. Thirdly, the academic burden around what we're trying to do with these individuals and the academic paperwork to set it up, and also the academic assessment burden would be far greater than what we need at the moment to develop these people in the pilot. So it would slow us right down. Fourthly, partnership working, absolutely. So we will look to interprofessional education with multiple providers in those study days and that bit. If we can partner up with advanced nurse practitioner programs locally and make that work, we will look to do that. But you know, when you're trying to set something up quick like this, partnership working takes an awful long time to get off the ground. But it's an aspiration in there, and we will look to do that. I would think that what we have done, with the experience I've seen from developing emergency department pharmacists in the West Midlands and what we've emulated now across the Northwest, a lot of the content of what you would do in an advanced practitioner we will bring through. But it's a different level completely in terms of where the pharmacists are starting from. And I don't know where they've come from anyway. So I totally agree with you. Yeah, I totally agree with you. Just a little bit more complex than going, yeah, let's sort that one out. I think when we're having this conversation in 4 or 5 years' time, it will look very different.
Okay, I think we'll have to call it a halt now. I think there'll be a chance. We're going to have tea break.